Hi, Dr. Fuhrman, and welcome to the GI Health Summit. Thank you so much for being here.
My pleasure. Great to be here.
Yeah. Great. I love interviewing you, Dr. Fuhrman. You've been one of the most wonderful speakers the past few years on the Truth About Weight Loss Summit. And this year after the summit, we actually sent out a survey to the participants asking what their biggest challenge was in adopting a healthy, whole food, plant-based diet and how we could assist them. And in addition to asking for more recipes, one of the top responses was that the reason people couldn't eat healthfully, especially eating things like vegetables in general and cruciferous vegetables in particular, was because there was so many people with GI problems going all the way from the top of the GI tract with reflux all the way down to the bottom with chronic constipation and everything in between like IBS and SIBO. And so I wanted to have you on the GI Health Summit because I know you've dealt with a lot of these issues with your patients over the years, because a lot of times they're put on diets from their doctors that are actually the opposite of what you recommend. Very low in fiber, very low in vegetables, maybe the low FODMAP diet, for example, where there's none of the foods that you recommend as essential, like onions. So I wondered if you could please talk a little bit about why there are so many GI problems in general, even with people that are, vegan and eating fairly healthily, and what we could do about it.
Well, there's a wide range of possibilities here, but the main problem with people's digestive tract is they're not eating a wide amount of plant foods. I mean, we know that that eating animal products, and particularly sweets and high glycemic carbohydrates, including honey and agave and maple syrup, we know that those promote unhealthy bacteria like bacterial species and Clostridium difficile and gram-negative organisms that shouldn't be there. What I'm saying right now is that, number one, an unhealthy diet promotes an unhealthy type of bacteria that leads to chronic inflammation. And we know that the link between these unfavorable bacterial species and your inflammatory markers like high-sensitive CRP has an inverse relationship. The bad bacteria go up. The bad bacteria go down and the CRP goes down. The bad bacteria go up and the CRP goes down, and the good bacteria go up and the CRP goes up, obviously. So the bacteria in the gut also protects us against the overly glycemic responsive foods. In other words, a healthy barrier, we call it the microbiome, and the biofilm as a result of this healthy microbiome creates a favorable biofilm that covers the villi in the small intestines, which now slows the absorption of food through the digestive tract wall. What I'm saying right now is that these foods that we're talking about, like beans and like mushrooms and like onions, and particularly artichokes and asparagus and zucchini, and that all these foods help thicken the biofilm for numerous reasons. And beans in particular, because they're so high in resistant starch, have a very favorable effect on enhancing the biofilm. So the combination of a nutritarian diet that I recommend with attention to eat all the G-bombs, GBOMBS, greens and beans and onions and mushrooms and berries and seeds, is the most favorable diet for your overall health and for a favorable microbiome. Scientists call that the second meal effect. The second meal effect means that the next meal or the next day, because you ate healthy foods in the past, your microbiome is already thickened and you're going to have a better digestion and slower absorption of glucose to the digestive tract wall. As a result of chronic inflammation and eating sweets and meats and dairy in particular, then we develop an unfavorable microbiome. We develop an unfavorable biofilm, and then foods just go through quickly. Now, when you have chronic inflammation and foods don't pass through quickly instead of slowly, you have more likely to have leakages in the gut and more likely to have peptides squeak through, and food doesn't get properly digested. It enters the bloodstream in a not totally digested or not totally broken down form. Now you have little pieces of protein could sneak through, and now you have chance for more bloating and gas and more reaction to foods. So the thinner the biofilm, the more reactive you're going to be to antigens in food. And what I'm saying right now, that clearly a standard diet high in animal products and high in processed foods is what promotes the gut to be highly reactive to substances. And it takes time to undo that. And sometimes there may be a period of months in adjusting where a person might have increased gas or increased bloating, or they're not used to having foods that have so much fiber in them. They can be sensitive to all this fiber. One of the factors that leads to chronic bloating and indigestion is also eating too much food and eating too much food at one time, because there's a lot of reasons why, but also being overweight also, and also having not proper functioning of your gallbladder, because the gallbladder secretes when you're not eating a healthy diet, and it could be a vegan diet. If you're eating sweets on a vegan diet, or eating things that are like fried foods, whatever, you could have congestion in your gallbladder, and your gallbladder then can produce acid bile and dump it into the digestive tract contents and cause indigestion, inflammation, and pain as the result of the gallbladder entering this caustic bile. So in some of these cases, I make people understand that this is going to take 6 months to get your bowel fixed up. We can't just feed you what makes you feel better, because you might feel better on a low fiber diet, but you're never going to get better. Then you're going to be sick the rest of your life and always having to eat a low fiber diet where you're avoiding those foods. Instead, let's try a different plan. We'll take the beans out for a while, if that's an issue. We won't make the salads, give big salads, and we'll give you some of the grains that don't have the fructans and the glycans. We'll give you some grains like quinoa, and not a lot of rye and wheat and spelt and things like that. And of course, no dairy, but we'll feed them a lot of cooked vegetables and cooked squashes and zucchini and kombucha squash, those winter squashes, and we'll feed them a lot of artichokes and asparagus and zucchini. But the trick here, and we'll even give them soup, vegetable soup and things like that, and also, of course, berries and fruits and things. But what I'm saying right now, banana and oats they can have, but what I'm saying right now is we might move them along to a diet that might contain more raw and more cruciferous and more onions and beans in a slower fashion. But what works though is getting them to moderately undereat, so they can making sure they're detoxing. What detoxing means, what I'm saying right now, is a lot of this stuff with indigestion comes from your bowel as a detox organ. Our immune system's around the bowel. We don't just absorb things from the bowel, we dump waste products into the bowel contents. And people don't understand that it's not even just coming from the gallbladder. This is a flow of substances through the bowel wall that can create, you're discharging things from the bloodstream into the bowel, and those could be reactive oxygen species and oxidized LDL and other acids, and you have an acid digestive tract. It's not just coming from the food. So when we get a person eating healthier and losing weight, we almost detoxing the body, their bowel functions better. And then we have to function, of course, in them eating, not overeating, and chewing each mouthful to a complete liquid before they swallow it. That's so key when a person has digestive disorder. They'll never handle a salad well or handle beans well if they don't liquefy it in their mouth. So I treat people with bowel disorders and indigestion all the time, and I'll even sit across the table and eat from them. And I'll say, I'm still chewing that mouthful. Mine isn't quite liquefied yet, and you already put your fork back in. I want to hold up for a second now. Let's make sure, is that just chewed so you can swallow? Or did you really feel that there was no particles of food in your mouth and that everything was a complete liquid? Because it's critically important for these people with digestive sensitivities to make sure there are no food particles or fibers that haven't yet been crushed by their teeth and adequately kept in the mouth long enough. So I know I said a lot right now, but we can go into a little more detail. But what I'm saying is the avenue is not to go back to eating a no fiber diet. The trick is to get the person gradually accustomed to a higher fiber diet over time and eat more cooked foods and less raw at the beginning. And also longevity, good health, and lower rates of inflammation are linked to a good variety of microbacteria in the gut, a good variety of healthy bacteria, hundreds of different species. So by narrowing your food selection, people going on these FODMAPs diet or these diets that are so restrictive, where they're just eating a very narrow range of foods, keeps their microbiome with a very narrow range of bacteria, and they're not going to achieve good health. we're always trying to increase the assortment of what food they're eating. And that means even if we're giving them a little bit of that other food, I might give a person like that I might start them on a diet that might be a little bit restricted as far as food choices, but then I'm going to give them pretty soon, I'm going to give them one piece of lettuce with each meal. It may be a softer lettuce like Boston lettuce, and they're going to start to really chew that well. And then they're going to have cooked cruciferous that are cooked, and then a small amount maybe raw in a salad like arugula, making sure they're completely liquefied. And then we add beans. They might just be adding 3 or 4 individual chickpeas to the meal, or a teaspoon of lentils to the meal. And then we'll try to use edamame or soaked and well-cooked soybeans. And then we'll add them in small amounts. And over time, we'll titrate the amount if they're doing well, and we'll increase it very gradually in their diet. So they slowly build the bacteria back over weeks to months so they can handle more of those foods. And I also want them to have the understanding that it's normal to produce some amount of gas. It's not, you don't have to feel something's wrong with you if you're producing gas. But the reason most people produce excess gas is because they swallow air when they eat, and that comes from not chewing food well enough. So back to chewing the food better and not overeating and getting back to your ideal weight. And sometimes you want to throw another element in this. Sometimes when a person has difficulty digesting, bloating, abdominal pain, then both intermittent fasting and water fasting for prolonged periods are helpful to reset the bowel again and slowly introduce foods again. And that means that they might be eating 2 meals a day and having a juice for dinner, or just 2 meals a day and having an extended period of not eating to allow their bowel to recover. But also it means sometimes I have them take 3 or 4 day periods, and that may have to happen 3 or 4 times of doing 3 to 5 day fasts 3 or 4 times, or 2 if they can on the weekends. If their work prohibits them from doing that, it may be a 2.5 day fast, on a weekend or something, back to eating food gradually again, and again doing a fast another 2 months later because the fasting intensifies the detoxification, the bile dumping from the liver, the acids being poured in your digestive tract. It actually makes things worse, but temporarily but then as they keep fasting and keep doing this, the body finishes the repair it had to do, and they start to not to have such difficult digestion. I'm adding an extra element to this idea that's saying that people aren't recognizing that the improper digestion is not all to bad bacteria. It's also due to kind of a detox effect of acids entering and acid compounds and metabolic waste entering the digestive tract from eating unhealthfully in your past. And believe it or not, that past life could have been years ago. It could have been you ate unhealthy for the last 10 years, and now you're eating healthy for a couple of years, but it's not healthy enough, and you're still a little overweight, and you really haven't finished your detox, and you're still creating a lot of bloating. So sometimes you really have to fine-tune a person's health to give them excellent digestion.
Yeah, that was amazing. Thank you. And, you're not the first doctor that mentioned the importance of chewing. And, I learned from you that Americans eat something like 92% of their calories from animal products and processed food, which have no fiber, which have no water, and really don't require chewing. You could almost swallow your chicken nuggets and your croissants whole. And it's almost like Americans have lost the ability to remember what it's like to chew food. And so when we give them these foods full of fiber, they're eating it the same way they ate the processed food and animal products.
Good point. That's a good point. I haven't explained it that way, but thank you for that. That was excellent.
Well, I learned from you, so thank you. But because people really, they don't chew their food very well, and if people just took that one takeaway from this summit and started doing that, they might find that they have some improvement.
Absolutely. If they just chewed their food better and did not overeat, if they are overweight, if they're steadily losing weight, then they're tweaking their diet in better shot. They're doing the right thing. If they're overweight, not losing weight, they've got to make a change. They're not doing the right thing, because maintaining the overweight condition creates chronic inflammation and dumps reactive oxygen species into the digestive tract as well. So if you're overweight, you're losing weight steadily, and you're not overeating, and you're chewing your foods to a complete liquid really super well, especially if you have digestive disability. Now, we know, of course, that food addiction is a powerful driver of people not wanting to change and eating healthfully. And it's difficult for people to stay on a healthy diet, to initiate the change, right? Because that's anxiety provoking. But then they have determination and persistence to do it a long time. And a lot of times with the social pressure of the outside environment, these people who have some emotional issues can't handle that. And the mind, the primitive mind, is looking for an excuse to go back to eating their favorite foods. And the excuse could be indigestion. So they're looking to have some complaints so they can say, so they don't stick it out till they get better. So they can kind of it's almost like they want to have to give it up to go back to their old way of eating and say, no, I can't eat that way. I tried it and I got to go back to eating meat and sweets again or whatever because I tried it and I got too much gas. And it wasn't really that they had so much gas. They're looking for that excuse. They're having a little bit of indigestion, trouble digesting, but instead of adjusting the diet and adapting to it gradually and making all the modifications to get there to good digestion, they're not willing to put in that work to get there. So they just make believe. So it just seems like they have to go back to their old way of eating.
Yeah, it's sort of like when people stop coffee, they get headaches, and so they have to go back to drinking coffee.
Yes. Right.
Well, you have always said, Dr. Fuhrman, that feeling better doesn't mean getting better. And sometimes people with GI issues, the foods that make them feel better don't help them get better. And the foods that help them get better initially maybe don't make them feel so good immediately. And that's, I think, why they quit.
Absolutely. And particularly, we have to feed people mushrooms to get their GI tract better. And they have to chew them. And even if so that's a food you don't want to take away. And some of these FODMAPs people take away the mushrooms, and the mushrooms are their secret to healing their gut. They're so beneficial to the gut wall. So if I could have the opportunity to list those foods again, I'm saying don't remove these foods from your gut because they're going to help you make a long-term recovery. And of course, those foods are mushrooms and steamed zucchini. And I'm taking the steamed zucchini though, and steaming it or dipping it in water, blanching it, with the whole skin on. Don't cut it up because then you're going to lose the favorable juices inside. Just steam it with the skin on. Once it's cooked, then you can cut it and eat it. So, and asparagus and artichokes, and buy frozen artichokes and eat them. Those are really good for the gut bowel. And of course, different types of squashes, including winter squashes, like those green, what are they called? Not kombucha, that's the drink.
Kabocha squash. Kabocha. Kabocha.
Kabocha. That's
right.
it. Those are really good to eat. The kabocha type squashes and other type winter squashes like that is very good for the digestive tract. And a favorable grain that if you can chew it real well is quinoa. I'm a fan of quinoa. And you can get dark and brown quinoas that are good for people too. So I think that those are, so I'm hoping people write down those starter foods and they eat more of those favorable foods and chew them really well. And then they can add on how much raw vegetables they can tolerate, how much cruciferous they can tolerate, how much beans they can tolerate. And they can add that over time and treat those in amounts. So when people say to me, I can't digest beans, I say, you mean you can't digest one chickpea? You can't digest one little lentil? How about a soybean? You just one soybean, one edamame? And soybeans, of course, are easier to digest and also a good starting bean because their amount of resistant starch is lower than the other beans. So we can give them a small amount of that too. And so they chew them really well, and you put that small amount in their diet, and they can titrate it up gradually. So they're not feeling totally well, but they have a tolerable amount of gas and a tolerable amount of, so it's not feeling too poorly. It's, I say the same thing with regard to women's postmenopausal estrogen deprivation syndrome, where they don't sleep well, they're estrogen deprived, they dry vagina, they're uncomfortable. And so we don't want them to use hormones so they feel totally comfortable, where they take away all the symptoms, because that's going to be too much, not going to be good for them. They have to titrate down to the level of hormone that just barely makes it livable, but not takes away all the symptoms. They still have to be uncomfortable, but at least sleeping okay, at least doing so we don't overtreat them. And then over time, they can get better and better with a smaller amount, and then they can go to a little less amount with time. But when we're trying to treat the symptoms, we want a little symptoms to remain to make that to recognize they're not overtaking too much estrogen, let's say, for example. And the same thing is true here. You don't want to cut out beans completely. You still want to have a little bit so you feel at least you're taxing the gut to learn how to digest these foods.
That's great. You mentioned that mushrooms especially are good for the gut, but you like people to cook their mushrooms, correct?
Absolutely. But also eat a variety of mushrooms. And in that variety of mushrooms, to use dried mushrooms too. Because, we know that variety makes for a longer life, but variety of mushrooms have a tremendous, powerful effect on enhancing the favorable variety of bacterial species that promote weight loss, bacterial species that make you healthy, that reduce inflammation and promote weight loss. And of course, people should be aware that these favorable bacteria have a beneficial effect on your emotions and your brain as well. So it makes you lose weight, they make you feel better, they reduce inflammation, and make you think better too.
I think sometimes when people have an adverse reaction to eating a food, whether it's beans or some cruciferous vegetables, and maybe they get some abdominal bloating, pain, distension, or gas, then they're afraid to eat it again. Do you know what I mean? Like it becomes almost a psychological thing because they feel they got sick and they stay away from it.
Mm-hmm. And they can also add them to a soup. So, and the other trick is that, let's say I can't tolerate raw broccoli. Or, they can eat other cruciferous, arugula, watercress, more gentle cruciferous. But if you take that broccoli or broccoli raw or whatever thing you were eating, if you blend it in the blender to a pureed form with a little ladle, a little soup liquid in there that you have, and then put it in your soup to cook, now you still got in your cruciferous, but you have it in a more digestible form, whether the fiber's been broken down by the blender, and then you cooked it to soften the fibers. So it makes it tolerable. The reason we're blending it when it's raw is because there's an enzyme in the cell wall of the cruciferous called myrosinase. And when it gets blended in the blender, it forms the ITCs that have the anti-cancer and anti-inflammatory benefits, because ITCs are the isothiocyanates, are heat sensitive. I'm sorry, I said it wrong. They're heat stable. You're not going to destroy them with cooking. But you would have, if you put the broccoli into the soup and you put it in big chunks in the soup, then the myrosis would have been destroyed, because you would have deactivated it before you broke and caused the chemical reaction to occur. You have to break the cells first. Usually we break the cells in our mouth. That's why we prefer to make broccoli in a wok, or to blanch it lightly, or to put some of those kind of things raw. We want to get the myrosinase activated, not deactivated. But here we're blending it, blending the broccoli or blending, and then put it into the soup or the stew you're making. And over time, they can start to do not have to cook it all. But all you got to do is just have more cooked. You have them cook it more. And I'm just explaining that if you blend it and then cook it, it makes it more digestible, including the fructans that are with onions, because onions are a favorable food. And if they're having troubles with that, blend it into an onion puree and then add it to your soup or your stew. So you're still getting those organosulfide compounds into your diet, because the beneficial organosulfide compounds from the onion and the beneficial ITCs from the cruciferous vegetables is going to help your body detoxify and heal and overall recover from your bowel problems. Because this is what all the GI doctors will likely do wrong. They'll think that a GI problem is a GI problem. They don't understand that when you have a problem in one part of your body, it's the whole body that's wrong. It's just manifesting symptoms in one part of your body. You know what I mean? When a person, and people say to me, well, what's good for my eyes? What food is good for my liver? What food is good for my digestive tract? And I'm saying, well, that's not the really way food works, because there's not a special food that's good for your liver and one special food good for your kidney. It's what's good for your body, what's best for overall health. It's best for your liver and your kidney and your eyes and your ears. It's all the food that's best for your longevity. It's going to slow aging, keep you young, and keep your brain functioning the best, is what's good for almost every part of your body, the GI tract included. It's just the GI tract might be sensitive from your past, and it may take time to get you there.
Thank you. Just that suggestion alone of a way to use onion and broccoli for people that are sensitive to those now, those cooking suggestions, those are very, very helpful. Thank you.
Welcome.
I heard you once say, Dr. Fuhrman, that if you don't like vegetables, you better live close to a hospital. And I'm thinking now where gut is concerned, if people don't eat vegetables, their microbiome is not getting the diversity that they really need for optimal functioning.
Yes, of course. That's why the vegetable-based diet has to be the cornerstone of healing an injured digestive tract. And you may have, but people have been trained since they're very young, almost since they're weaned from the breast, to overeat, because in our society, people are, how should you say, it's more favorable for your child to look plump, to look more round and to look fatter, and they cherubic or whatever it's called. In other words, it's more favorable to, and then parents brag how big their kids are and how fast they're growing. They're not understanding that the skinnier they are and the slower they grow, the longer they live. And if they exceed parental height, if their predicted height is larger than how genetics would have predicted their height by their parental height. Parental height predicts genetic height for your child, and if you exceed that, it's not favorable to feed your child to maximize growth. So what I'm saying right now is we have a whole population that's been trained to overeat. So now when they go and they start to eat healthier, they're still overeating, and they're chronically overeating food and stuffing out their stomach and eating till they're full and eating too frequently. And the digestive tract never has a chance to heal between meals to digest food well. Let me explain this one more time, is that we have glands that line the digestive tract that secrete, they collapse and expunge their contents and drop their enzymes onto the food we're digesting. So let's say I have this tear-shaped gland that is now squeezing down and releasing all their digestive enzymes onto the digestive tract. Now they take hours to fill back up again. Now the enzymes may not come back in that gland for them being ready to digest food again, especially if you're eating a heavy food like beans or something, or nuts, or meat. Then you're not going to have a good enzymes to digest those foods in 3 or 4 hours after you just ate. You got to wait and not eat for a while. So the idea that people are chronically snacking and putting foods in their mouth and recreational eating all day and then overeating, their next meal is often consumed without having the digestive and enzymatic capacity to digest it adequately, because they've overeaten in the prior meal and enough time hasn't passed until they began to eat the next meal. So another element is that people are, what I'm saying right now is they're so chronically adapted to overeating and eating so much food and so frequently that it also interferes with digestive capacity and digestive efficiencies when they start eating a diet that's healthy with a lot of fiber.
And so many people, even if they're not overeating, are eating so late, like right before. So many people I see eat before bed.
Right. That's the secret trick. The secret trick to good health is that we've learned recently, like in the last 3 to 5 years, we've learned this. And a lot of us in lifestyle medicine have changed their advice based on this unbelievable amount of research that come out in the last 5 years, demonstrating how beneficial it is to finish eating dinner earlier and going to bed on an empty stomach. Of course, it makes sense. When you sleep is when your body heals best, and you get rid of the brain gets rid of the reactive oxygen species in the brain while you're sleeping, and your digestive tract. So of course the repair process, we know, and I've been saying this for decades, that the detoxification process in which the body is able to reduce free radicals occurs best in the non-feeding state when digestion has ceased. It's over. So we can effectively detoxify, enhance cellular repair, remove free radicals, advanced glycation end products, and acids like ammonia and uric acid and urea. We can actually get rid of toxins better when we're not digesting food, when it's finished. And since that's the purpose of sleep, is to do that in the brain, and then we do it better in the brain when the body is doing it at the same time, it makes so much sense. And now we're seeing studies that show that it enhances longevity, it slows aging when we eat an earlier dinner, or it's the most important thing is trying to go to bed on an empty stomach. And I'm not always perfect on this. Sometimes I eat dinner early and then I didn't eat enough food, or I ate too early and I'm really hungry at night and I give in and I have something at night, but I'm still tweaking it and I'm working on it and I'm trying to get it I'm not saying everybody's not perfect, but we're trying to do the best we can. So most nights to time the food, and if I and so I'm not too hungry at night, but a little bit of hunger before I go to bed at night, and just have a little water and go to bed or something. I'm tweaking that. And everybody should be working on this. The amount, tweaking and working on the amount of food and the timing of the food, and that'll improve digestion too.
So probably these midnight buffets that you get on the cruise ships, probably not a good idea.
Yeah, right.
Okay. So Dr. Fuhrman, what effects specifically do animal products in general and dairy in particular have on our gut in general, but especially people that are suffering?
Well, you can imagine that the more you eat foods that are high in protein, means that the body dumps acid into the digestive tract. And it jumps, the amount of acid it dumps in there is proportional to the amount of protein, particularly animal protein, as a very strong stimulant for acid dumping into the digestive tract. So what I'm saying right now is a lot of people have heard something about having an alkaline diet versus an acid diet, and eating alkaline foods and not acid foods. And it's funny how that eating acid foods promote acid bacteria. We're saying gram-negative bacteria instead of gram-positive bacteria. But you eat these acid-promoting foods, and I want to make this clear, that the acid, you're not acidifying your body or your digestive tract from eating tomatoes or a lemon or an orange that people think are acid or acid. No, the acid in those foods that you think are acidic is microscopic compared to the huge amount of acid produced by eating an animal protein and the acid the body produces by itself to dump onto the food to digest it. What I'm saying right now is when you have an acid pH in the urine, or you have your blood is too acidic, or when your digestive tract is too acidic, it's the own acid your body is producing. It's not the acid from the food. And you know that all these people with acid reflux and are always saying you can't eat tomatoes, you can't eat oranges, I can't eat this, it's all acid, they bother me, whatever. So I'm saying that but mostly what produces huge amounts of acid that's destructive to the digestive tract lining is eating, of course, animal products. And then the lack of diversity in the bacteria and the overgrowth of unfavorable bacteria make you more prone to having bowel infection or something that could trigger stress, and getting sick, taking an antibiotic, taking a drug, some kind of thing, taking something toxic. Some people could eat a head of cabbage and they could have dumped some pesticide on the cabbage or something. And if they're eating some food, they don't realize there's some chemical on it that they took into the body, and they start to feel sick. What I'm saying right now is that the animal products and the lack of diversity of the bacteria in the gut makes your body with less resiliency, less ability to deal with an immediate stress like COVID-19, or like being exposed to a toxin, or being exposed to pollution in a fire or something, or a tremendous emotional strain in your life. When your body is teetering and eating unhealthily, and you're below the level of perception, so you don't feel unhealthy, but you're not eating unhealthy, then some stress factor can throw you over into a serious medical tragedy or medical disease. So all these things play a role. Even if you feel well, you're not well. And I always say to people, there's no such thing as a healthy overweight person. Because I know that the overweight community likes to teach people that you can be healthy and overweight at the same time. And I'm saying that's totally not true. They do not live together. That you can't be overweight and healthy at the same time, because fat cells throw out toxins, harbor and increase insulin resistance. They throw out inflammatory substances like cytokines and lipokines, which make you prone to cytokine storm, and they otherwise have negative metabolic effects on the body. But those metabolic effects that are negative, which can increase your risk of death from something like COVID-19, immediately start to be reduced and go to a safer spot when people start to eat healthier and lose weight. What I'm saying right now is that if you're 50 pounds overweight or 100 pounds overweight, you're not going to be to a normal weight in the next couple of weeks. But in the next couple of weeks of losing weight and flooding your body with beneficial foods, even if it causes some gas or indigestion, you could immediately start to lower inflammation in your body, lower the risk of cytokine storm, lower insulin resistance. We can see beneficial changes occur, protecting people by 100-fold degrees of protection against, let's say, harmful effects or death from COVID, just because they made that change or losing weight, eating healthfully, even if they're still overweight. We don't have to say to a person, you're still going to be, in other words, they can dramatically reduce the risk if they're steadily losing and eating right. And the reason for me saying this right now is to make sure people have hope. They don't throw in the towel and they say, well, I'm never going to lose my weight. I'm never going to get to a normal weight. I'm going to, and I might as well just be fearful and give up and check out and not even try. And I'm saying, no, that's not occur. You can actually get rid of diabetes while you're still overweight if you keep losing weight steadily. And our experience has been where we use 2 pounds a week for a significantly overweight person, like 40 pounds overweight or more. We want them to lose at 1 kilogram a week, because that's when we really see the beneficial effects we see on estrogens dropping, CRP improving, white blood cell counts dropping, insulin resistance enhancing, so insulin sensitivity enhancing. So we start to see, and the immune system function coming back to normal. So I have a lot of people that are overweight following the plan, losing weight, and I feel they're protected because they've done such a good job and they're doing such a good job moving in the right direction. And they have a kind of less fear about COVID-19.
Thank you. Why are dairy products so problematic for people with gut issues?
Well, we know that fiber is the key to promote the growth of good bacteria that produce the short-chain fatty acids that have the negative feedback loop in the central nervous system. In other words, what I'm saying right now is that when we eat foods that have no fiber in them, we're not going to have a favorable response. But besides not having fiber in them, they still are very growth-promoting food, which cause a hormonal imbalance. Dairy products cause a hormonal imbalance towards growth. They accelerate production of growth-promoting hormones like IGF-1, insulin-like growth factor 1. So, and insulin-like growth factor 1 has the word insulin in it, and it has the effect to bind to the insulin receptor. And just like eating sugar, and makes every food more glycemic, and the surge of sugar into the bloodstream has a negative effect on brain cells, and the surge of sugar also has a negative effect on bowel function. So what I'm saying right now is that when you eat dairy products, because it raises IGF-1, it has the effect to make you more insulin resistant and to make the sugar you eat more dangerous as well. And also, when you eat dairy products, it makes other things more dangerous. When you eat beans, or when you eat greens, or you eat mushrooms, it makes other things less dangerous. It makes other things you're doing, it's not right. It makes them less harmful, and dairy products make things more harmful through multiple mechanisms, including we're talking about the bacteria that live off dairy, that dairy products produce in the gut, mostly the Enterobacteriaceae, I think that's called, Enterobacteriaceae, that lives in the gut, and those are gram negatives that are promoted from eating dairy products, are very negative here for digestion and particularly for inflammation.
Yeah, absolutely. A few years ago, Dr. Fuhrman, I don't think anybody ever really heard the word SIBO, but now it seems like everybody either has it or knows someone that has IBS and SIBO. Why do you think it's the people are more getting the diagnosis, or is something changed that so many people seem to be suffering with this?
I think that it's just that more doctors are making a diagnosis on the same amount of people that were suffering with it. So I think that it's just doctors will throw out the diagnosis and they have the ability to test for it, or they didn't have the ability to test for it in the past. And of course, taking antibiotics, so that's saying that you have an overgrowth of bacteria in the gut. And then they give you antibiotics to lower the growth of bacteria in the gut, which then lower the growth of good bacteria in the gut, which means the bad bacteria regrow again. The person temporarily feels better from taking antibiotics, but it's not a permanent solution. It actually can make things worse over time, as you're still not having a favorable, not producing the right soil for your garden, and you think that just killing the bacteria. That's the medical profession works. They're always looking for something they can treat with a drug. So we have diabetics being treated with diabetic drugs because we can measure the blood glucose, and we have drugs that can lower it. If we didn't have drugs that could lower it, then doctors wouldn't be so concerned with measuring it more, because being overweight is more of a problem than your sugar running a little high anyway. So people allow people to be more overweight. They give them drugs that cause weight gain and they're controlling their sugar, and the drugs make them control their sugar and cause them to gain more weight. why wasn't the weight gain is a stronger factor on modulating longevity than even the high sugar would have been. So they're just changing one thing they can, but it's the same thing with cholesterol, with blood pressure. We're giving people drugs to just moderate the soft endpoint, not the hard endpoint, which is death or cancer, because the drugs then increase the risk of cancer. So here we're giving people drugs that can cause cancer to moderate their soft endpoints, which we can measure the excess bacteria in the gut, instead of getting them to chew better and to eat less food and to eat less often and to, so we're talking about and to increase their diversity of food, but of course, it's increasing diversity in the plant kingdom while removing the animal products or reducing the animal products and the processed foods and the flours and the sweets as well, and the oils, right? So we have to get, so I'm suggesting that with the judicious use of intermittent fasting and prevent people from overeating and eating right, we can measurably reduce the excessive growth of bacteria in the gut. And we don't have to give people an antibiotic to get there.
So even if they have the diagnosis of IBS and SIBO, there's ways they can get better eventually without having to take antibiotics, you think?
Exactly. My fear is that giving them antibiotics makes them feel better in the short term, but it's not going to solve anything in the long term and could further complicate the issue in the long term. They could, So we want to give them a way, it's always better to do things naturally. I remember in medical school, in the first pharmacology course that was given to us as first-year medical students, the professor said that never forget that all drugs are toxic and they work by blocking or interfering some natural body action. And the majority of them are likely carcinogenic. And they also, neither do we study how drugs are used. When the drugs' side effects and dangers are studied, they're studied when people just looking at that one drug. They're never studied in polypharmacy situations where people are taking multiple drugs together, where they increase their side effects and medical risks. And as physicians, we should be striving to remove the cause of disease, to enable people to avoid medicinal substances as much as possible. And you learn this in the first course, or at least I did, in the first year of medical school. And then as you go through your medical education, it's never mentioned again, and you're just learning how to treat people with drugs. And people get out in practice, and people come into their offices, and they're anxious to write prescriptions because it makes the doctor look like they're worthful, they're useful. The person comes there, a person that goes to a doctor, a medical doctor whose job is to prescribe drugs, is paying their money to see a doctor is like saying, I'm coming in to pay you and I want a prescription from you. And the doctor's obliged because they want the patient to come back, so they give them a prescription. So doctors are going to, they say, a carpenter who has a hammer and a nail is going to look to use it, you know what I mean? But what I'm saying is right now is doctors overprescribe. And I'm trying to do the opposite, is underprescribe or not prescribe. It's funny because I'm working here in California and being with a lot of naturopaths, right? Who don't give as much you think is drugs, but I'm finding out that they overprescribe. And the naturopaths overprescribe. I'm saying I'm more of a naturopath than the naturopaths. Because they're giving people antibiotics and they're giving people more remedies, more natural remedies, and I'm trying to get them off the remedies and get them well so they don't need as many remedies. You know what I mean?
Maybe just have on your prescription plan, eat fruits and vegetables.
Well, of course, because of the complicated nature of people's conditions, they need a little modification and tweaking to meet their individual needs, and especially in their transitional phase coming off drugs, and especially sometimes transitioning to healthy eating when they're having these digestive difficulties. So that's where the experience, of course, and giving people those options are helpful. Even some natural substances can be helpful in transitional phases, but not to the extent that, people just throwing drugs and remedies at people.
Yeah, of course. And it's amazing how many people are on more than one prescription. It's mind-blowing.
Yeah.
Dr. Fuhrman, you mentioned not to have flour, oil, and sugar. I was a pastry chef. If you take those things away, you're not going to be able to have cake. So why are these things so bad, especially for people with GI disorders?
The cake diet, we're going to take their cake diet away. Now I always say people they eat cake for breakfast. They eat, what do they eat? A little muffin? That's cake without the icing. It's like a cupcake without the icing on top. Or they have a cold cereal, we find they're just eating sugar and flour. And then what is pizza? It's a cake. They have pizza for lunch or a burger for lunch, cake with meat on it or a cake with cheese on it. They're just cake. And then they have pasta. They're just bread and more, but it's just like, and then it's a cake diet, you know?
Sounds pretty good.
See, the glycemic effect of a grain is proportional to how finely it's been ground. And even whole grain pastry flour is a high glycemic food. Just because it's made from whole wheat doesn't make it low glycemic. And commercial baked goods that you buy, they're grinding those wheats into pastry flours because people like that soft mouthfeel that melt in your mouth. You know, the whole wheat breads are like mush, except for one that maybe there's a Food for Life Ezekiel bread that still has some substance to it, that they're not grinding it to a fine mush grain. And I'm saying it's not even bad enough that people are eating these grains. It's worse if they grind them so fine. You know, so I eat a little bread, but I'm eating I only eat those two brands. I eat the Ezekiel brand, you know, and I eat not much, but, you know, once in a while. And I have sometimes the manna bread. It's like made from a sprouted loaf or something, you know, because they're not finely ground. And when they're not, and so when you finely grind the grain, it also causes more oxidation and more destruction of the nutrients that were in the grain as well. So some of those grains are relatively wholesome, are high in vitamin E and selenium, and have a lot of favorable fibers to grow bacteria. But if you cook the grain in water, and if you make it into a loaf that you put it the whole grain, not the flour, but the whole wheat berry or the whole spelt grain or whatever, you put it in your, let's say your Vitamix, and you just pulse it a little bit and grind it so it's not so finely ground, and then you soak it for longer. And then you mix it with some, chopped apple skin or mashed banana or avocado, and you make I'm saying avocado instead of the oil. So then you're making a homemade bread that's going to be more coarse, not as fluffy. Now you have to let it sit with the nutritional, with the yeast for a long time, but then you can make a bread. But what helps also, besides making the grain more coarsely grind, is removing some of that flour and then substituting some, of course, bean flour or nut flour in, because then it's lower glycemic. So we're going to, use a little soy flour or a little bit of, chickpea flour or whatever kind of, almond flour, a little bit in there in the grain, and so you can make a bread that's not as glycemically unfavorable, and a person could have a small amount of it. So I'm saying that you were saying the most of the bad things about flour is how finely they grind it, but the high carbohydrate grain is worse when it's more finely ground compared to a lentil or a chickpea or a soybean that's more finely ground. Doesn't have as many negative effects as grains being so finely ground. So that's why mixing that is somewhat helpful in the recipe you're making.
And sugar and oil, these are not favorable in general for our health, but especially for our guts, correct?
Right. You would say that the high sugar causes the overgrowth of bacteria. And you know what? And artificial sweeteners are even worse, like aspartame and erythritol, and all these things cause overgrowth of bad bacteria and perpetuate people's inability to digest vegetables because they're still using artificial sweeteners and sweeteners on their food. And that includes honey and maple syrup. If they're having digestive issues with sweeteners, just sweeten things with mashed banana or some other gentle sweetener with the whole fruit. And then if they're healthy enough, they can tolerate a little bit of dried fruit here and there in their diet, but only if they're having digestive trouble, they should just use the whole fruit or just mash a banana up and mix it with something.
And that's great. I've done a lot of recipes just using that. Use the whole fruit, and nothing but the whole fruit. So help you God. What about, like, a lot of people like stevia, but that's not good for your gut, I'm told.
It's really not ideal for the gut. It may not be as bad as other things like aspartame, but it's still not good for the gut, and it's also not good for the brain. And also, it gets people. How should I say? It perpetuates the desire for everything to be too sweet. So it allows them to make things overly sweet, and then they just continue to be desirous of things that are too sweet. And it has it doesn't allow their taste buds to mature and to get to be able to enjoy the sweetness in a strawberry, or the sweetness in lettuce, or the sweetness in avocado, or the sweetness they don't enjoy the sweetness that's there in food, like the cashew nut, for example, because they deaden their taste buds, and then they continue to overstimulate them with stevia, monk fruit, and other even sweeteners that are otherwise low in calories and aren't that dangerous. They're still perpetuating their addiction with things being excessively sweet, and it makes them desire to eat more sweets, and it makes them desire to overeat. The main problem with monk fruit, stevia, erythritol, and xylitol and these low-calorie sweeteners is it keeps people wanting to overeat. They're appetite stimulants, and they're working the brain to make you desirous of eating more sugar.
Great, thank you. So, what about coffee or caffeine, the effect it has on the gut? Because some people I know have chronic constipation, even if they're on a fairly healthy vegan diet, and they say, well, without that coffee, I just can't go in the morning.
Really? Wow. So yeah, some people are different, and I usually will add a little magnesium. My choice would be to add magnesium. I don't want people to drink more than 1 cup of coffee a day because of the extra caffeine, and not use too much of that for a laxative effect. And the other thing is that saliva, the lack of saliva in their food makes them constipated, and maybe they have to drink in between meals to keep the bowels don't get too dry. So one is drinking a full glass of water halfway between lunch and dinner, between breakfast and lunch, and you're eating a high fluid lunch without salt, and then a glass of water halfway between lunch and dinner, and another glass at bedtime. The point I'm making is make sure there's fluid coming into the bowel. Don't eat too much dry stuff like dehydrated foods, dried fruits and dehydrated foods are things that are dry. Eat a wet, a moisture-based diet. And salt dehydrates your stool too and takes water out of the gut. And of course, get a lot of saliva in your food, which means chew better. These people do better when they chew better because now their food is being digested. There's a lot of saliva in the food, and it's when the food goes down without the saliva in it, and they can become constipated.
So really, digestion starts in the mouth. And back to what you said originally, people need to chew their food.
They need to chew much better, not just a little better. They have to chew a lot better.
Right. Well, I was taking notes as we spoke because I too don't add any salt to my food, but I never heard anyone say that salt dehydrates the bowel and it takes water out of the gut. I never heard that. So that's yet another reason to maybe not eat it.
Yes, because you know that salt's going to increase your blood volume and make your blood swell with fluid. And where does it get their fluid from? It makes the stool more dry, which then hardens the gut. So whenever your body needs, like if you're getting dehydrated and you're doing more running and more exercise and you're sweating more and you don't drink, you're going to form a drier stool. You're going to dehydrate your stool, and your body needs water. It takes it out of the gut. We don't want our gut stool to be wet. We don't want it to be dry. We want it to be wet so it passes through nicely. So if you're going to dehydrate yourself, so of course salt is going to dehydrate, is going to dry out the stool.
Interesting. I don't eat it, so but I never heard of that before. So thank you. There are people, and again, and unless they're lying, they say they're following a nutritarian diet, or at least to the best of their ability, but they're still constipated. How can that be? Are they just not exercising, so their gut's not moving? I mean, what do you do? What do you recommend for chronic constipation, or any constipation for that matter?
Well, that's very, very unusual. Number one, because obviously I'm eating all this high fiber, high water content food that has a lot of water soluble materials and both soluble and insoluble fibers that hold water in the gut. So it's would be very, very unusual. So it usually means that there's a slow transit time, and I gave the formula for what they need to do, and over time I'm sure this will work for them. But of course, at the beginning, if they're still constipated, they should use something like a little extra magnesium at night would be the simplest thing they can do. Like they could even take 600 to 900 milligrams of magnesium at bedtime or after dinner, right after dinner. And because magnesium holds water in the stool and makes your stool a little softer. We're not using laxatives, because the chronic use of laxatives like sienna and cascara can make the nerves in the gut insensitive to stimulation of the food and make people develop chronic constipation. So avoid laxatives. We're just going to use things that are, like a bowel emollient that holds water in the stool. And so it's things that are more gentle, and then they're easy to wean off them as they improve their diet. It's usually the result, what we discussed earlier in this podcast, that people are still suffering from the effects of their bad diet that they ate years ago, and they have more spasm and inflammation in the gut, and there's spasm, and things are being held up because the body is not relaxed. And stress could be an issue. Emotional stress could be an issue, causing spasm in the gut, indigestion, and abdominal pain, and constipation. So emotional stress could be causing that. And people in today's society, people are involved with, how should you say it? there's no kindness, compassion, appreciative gratitude, where the people are, the selfish mindset, and this people need to get more training in mindfulness and being at peace with themselves and with others, and all the antagonism between groups of people, and the drive to be superior, or to drive for achievement or get approval from other people. It's put people on so much stress. They're being taught all bad things to emulate in today's society, which put people under chronic stress, which leads to digestive issues. Your digestive tract is a total expression of the digestive tract affects the brain, and the brain affects the digestive tract. They're intimately connected by nerves, and the bacteria send signals back and forth too. And if you're not going to be at peace with yourself and content with your life, you're not going to have good digestion, either. It's going to affect digestion. So it's again, we have to see people in a holistic manner. When we're dealing with people that are overweight, we're not just treating the diet, we're treating their personalities and their emotions and trying to get them to be happier. So they're not reliant on food for their happiness and for their pleasure. They're not utilizing food for the wrong reasons. And this is all back to the questions you're asking me about why people are still constipated, they're eating right. There's a lot of that could be other factors involved that are have to do with stress and emotions as well.
Oh, thank you for addressing that. What about the opposite? Some people tell me, well, I can't eat all those vegetables. They give me diarrhea.
They got to chew better.
All right. What about alcohol? So many people have the idea that it's heart healthy, but like you say, if it's good for one part of the body, it's probably good for all parts. And the same thing, if it's not good for one part, it's probably not good for all the parts. So since we're talking about gut health, what effect does alcohol play?
Well, alcohol is an inflammatory substance. You're pouring alcohol, which is an irritant. You're irritating the digestive tract. And it depends on how much of it you use. But we know that even in studies that show that women, for example, who have 1 glass of wine per day increase the risk of breast cancer by about 10 to 15%, depending on the study. So even moderate use of alcohol has a negative effect on cancer. And it also causes increased cancer of the digestive tract itself, not just of the breast and the prostate, but also the digestive tract and being exposed to it. So it's interesting to see that in the last 5 or 6 years, the things that I've been advising people over the last 30 years, now we have regular medical doctors and more medical research journals coming out saying there's no healthy amount of alcohol. Even a moderate amount of alcohol is overall harmful, and there's no overall heart benefits to people using alcohol. There's no weighing when we use alcohol, we're doing something negative, not positive. And just because alcohol or just because wine contains resveratrol or other beneficial substances from grapes, it's still better if you got those substances from eating real food like mushrooms and fruit than if you got them from drinking alcohol with the substance in it. So it's still, I could not advocate that, but if that's going to make the difference, a person had 1 or 2 a week, not to take away all their pleasure if they feel, I will sometimes say we'll just do 1 or 2 a week then, not 1 or 2 a day. But still, it's not something we're encouraging people to do.
Right. But you do encourage people to move their body every day, right?
Move their bowels every day is what you're saying?
Yeah, that too. Move their body. Exercise, in other words.
I was just kidding.
Well, you cracked me up.
And we're talking here we're talking today in this interview about eating a large variety of different substances, to have 100 different species, hundreds of different species of bacteria in your gut. And we should do a wide variety of physical modalities too. I try not just to run, or not just to bike, or not just to swim, or not just to exercise with weights, or not just to stretch, not just to do yoga, not just to do McKenzie back exercise. I'm trying to do a little bit of different types of exercise. And I think that's the best way to go, especially as you get older, is not to stress your body out by running for 25 miles a week, but to run for 2-mile runs or something, run 5 miles a week, and do other exercises. So do a variety of exercise. It's better to hit your body in different ways, and keeps you not only fit, but it keeps you more resilient to getting injured, and more balanced, so you're not having muscular imbalances.
Right.
Wear and tear on the body too.
And for those that have that those that have that stress component and with their GI health, it's got to be great for that as well.
Yes, sure it is. But they got to get to but we have to get to the cause. And the cause sometimes it has to do with what they've been trained, how they've been trained to think by their social environment and their parents. And that takes counseling and changing their individual drives and what they've been going for in life. They got to really sometimes rethink their life's purpose to be able to be at peace with themselves, which can take time.
Dr. Fuhrman, what's the truth about GI health?
The truth about it, which I don't have the truth about anything per se, but I'm saying the truth about it is don't focus on just GI health. Don't separate your GI from the rest of your body and focus on your overall health. And only by focusing on the overall health will your GI tract come back to good health. That's the secret.
Beautifully said. Thank
you.
Get
enough sleep, get into the exercise, all these things, have the right mental attitude, all these things, get rid of your stresses, have the passion for living, appreciate the world around you, be grateful for, see the goodness in people, work to help other people, feel good about all these things are important. The food, the way you think, the way you're sleeping, all these, learn how to meditate could help it all. Put a holistic approach to getting healthy into your life, and your GI problems will take care of themselves.
Beautifully said. Thank you so much, Dr. Fuhrman.
My pleasure. Best health to everybody.